we give Tylenol all the time, literally all the time, but a lot of people just don't know how it works, and honestly, it is not as simple as it just like blocks pain. So acetaminophen actually works primarily in your central nervous system, not out in the tissues like an NSAID would work. So instead of reducing inflammation on the periphery, it's actually happening in the brain, specifically by inhibiting prostaglandin synthesis, and that actually lowers the brain's perception of pain. It also resets the hypothalamic temperature set point, which is why it works in fevers. So that's kind of cool. Little nugget for you. There's also evidence that it interacts with serotonin pathways, which kind of explains why it may have an analgesic effect without being an opioid. So it's not an anti-inflammatory like ibuprofen. It's more of a central pain modulator, if you will. Now, pre-hospital Tylenol, we typically give it in the IV route, right? IV route is very predictable. Our patients, we can't rely on them to be able to swallow, or maybe they are in a condition that is making them critically ill, and we need to give it intravascularly. It's wonderful. It's beautiful. You start seeing effects in about 5 to 10 minutes. It peaks around 15 minutes, which is great. In our, short patient interactions that we have in the pre-hospital setting. And clinically, you're using it as multimodal pain management. So instead of jumping straight to an opioid, IV Tylenol gives you a way to reduce pain while avoiding respiratory depression, hypotension, or altered mental status. And it's usually used in conjunction with other medications. So it's usually it's not by itself typically. But it's a good one. It's also obviously an opioid sparing medication, meaning it often requires less fentanyl or morphine when you give it alongside those other meds. But remember, like any med, it's not harmless. You still have to respect dosing limits because at high levels, Tylenol is metabolized into a toxic compound called NAPQI, which can overwhelm the liver and cause catastrophic liver injury. So yeah, Tylenol is actually doing a lot more than people think. It's working centrally by modulating pain pathways, it's affecting your temperature regulation, and giving us a solid option for early, safer pain control in our pre-hospital setting. So we love her.